Good afternoon and welcome to Mercy Health's Muskegon Healthcare Spotlight, where each week we'll bring you an important and helpful information that helps you become more informed and involved in your healthcare decisions. We believe that carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based environment that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. Thank you so much for joining us today. I am Erin Patrick. I'm the Regional Manager of Public Relations and Communications at Mercy Health. And today we have the privilege of talking with the President of Mercy Health Muskegon, Greg Loomis. Thank you so much for coming.
Well, thank you, Erin. It's my pleasure.
And I'm going to open this radio show this weekend with a few choice words, so stand by, Greg. Integrity, funny, transparent, humble, funny, honest, funny, hilarious. This is just how some people who know Greg would describe him in one word. Over the past 48 years, he's built a career in healthcare with Mercy Health Muskegon, and he's here to describe his journey. Welcome to the studio.
Thank you.
I'm waiting for the jokes because funny came up quite a few times.
You didn't tell me about the funny part. That's putting the pressure on me.
It is. Well, we don't have the comedic drums in the background. We'll focus on your professional career today, but maybe we'll get you on jokes for another segment.
We'll see what we can do.
Okay, so let's jump in and discuss how you got your start in healthcare. So give us the span of your career timeline and how you started and where you ended up today.
Okay, well, that's a long story.
It's a long story. Brace yourself, Muskegon community. This is an awesome timeline.
So I got my start in healthcare back in 1969, which is unbelievably 48 years ago. It seems hard to believe, but I was a high school student, just about ready to start my senior year, and I had planned to be a co-op student. I don't even know if they have that anymore, but co-op student, you go to school half the day and you work half the day, and I was in need of a job to do that, and they connected me up with Hagley Hospital, and all my work had been on a farm prior to that time, and had nothing. I'd never thought of working in a hospital, but they called me up and asked if I would want a job at Hagley Hospital in the storeroom. And so I said yes. It was sounded good. It sounded clean compared to the farm, right?
Right.
And they were paying I think it was like $1.40 an hour. So
wow.
it was really good money.
Yeah.
And I that's how I started in healthcare. And I worked in the storeroom, and my job was to unload trucks, put supplies away, deliver supplies. But
right.
I actually, so that's where I started.
And let me chime in real quick. What high school were you attending at the time?
At that time, Reese Puffer.
Okay, so you were here you were a Rocket.
I was. I had gone through 10th grade through Muskegon Public Schools, but had my last 2 years, I had transferred out to Reese Puffer. So,
well, we are both Rocket alumni, so cheers to that.
There you go.
Okay, so we've done the co-op. You started at Hagley Hospital in the storeroom. Tell a little bit about what kind of work you did there. Well,
let me tell you why it's even important to talk about that, because since then my career has changed a lot, but those were formative years, of course. I was 17 years old, and here's a story I tell to all new colleagues who start at Mercy Health. I tell them the story about I walked in, and I met the department director. He is the purchasing agent. And, I also tell them that back in 1969, of course, he was standing there smoking a pipe.
Inside?
Oh, yeah, because you could smoke almost everywhere in a hospital back then.
Of course.
You couldn't smoke. You could never smoke by oxygen, though.
Okay.
That was not allowed. But anyway, I walked in, 17 years old, and this guy says to me, he was old. He's like in his 40s. And he said to me, you need to understand that everything you do in your work will have an impact on our patients. So make sure you do it well. And so today I tell that same story to our new colleagues because honestly, 48 years later, I have no better advice for them than to remember that the reason you're working in this organization is to serve our patients.
Right.
So it kind of gave me an opportunity to share that story, and I remember it as plain as day. And so it's really odd for me to be in the position I'm in now and standing. When I tell the new colleagues this, I'm probably 50 feet away from the space that I worked in back then. It doesn't exist anymore. It's on the outside of the wall, but
it's where the green area is, right?
The green area. That's that used to be my work area.
Yeah. That's just interesting. I know you've told me that story before as we've been walking by. And you're like, here's where I started. Here's where it all started.
Yeah.
So after the stockroom, what happened? What was your next milestone that came up after that?
I worked in the storeroom, of course, my senior year, and then I graduated and kept working because that was my plan, to just work at the hospital. And they hired somebody new into the storeroom who had just retired from the Navy.
Okay.
And he was a retired hospital corpsman from the Navy. And, of course, we worked together for a year, and he kept telling me the good stories about his career in the Navy. And, of course, back then it was still during Vietnam, and I had my draft number was like number 81. And
that's low.
Yeah, so I kind of had a good chance of being drafted. So I went to join the Army, and I don't know why I was going to join the Army. Oh, I know, because I had a friend that wanted me to join the Army. Turns out the Army recruiter wasn't in. It was down at the post office building, so I walked across the street and joined the Navy.
So just because the Army guy happened to be on a break, that led you to the Navy at the time.
Yeah, he wasn't in, so I remembered the stories that I'd been hearing from, and I arranged to be a hospital corpsman, and so I took a leave from Hagley Hospital in 1971.
To serve, yeah.
They gave me a military leave, so I went in the service in the Navy for 4 years, got out, and I was able to come back and bump back into my job. So
how did that go?
It went well. I came back, and I met the guy who was doing my job, and I told him I'm back and sorry, and he left. No, he actually had another job, and we turned out to be good. He was a good friend.
You just got a point for being funny.
Okay.
You got it.
All right.
It's in the books.
One funny point.
Yeah. Okay,
right.
So you're back after your leave of service, and you're working in your same job from before?
Back in the storeroom, but now with 4 years more of experience. I'd worked in hospitals much of my Navy career, of course, as a hospital corpsman, and so I was kind of looking at what's next, and I started at community college. This would have been 1975, so I think it was 76 that I started at community college. I also began working in the print shop. That allowed me to go to college during the day and work second shift at the print shop at the hospital.
Okay.
So that's so I advanced. I don't know if that was an advancement or not. I used to print the tests for the student nurses.
Oh.
Yeah.
Interesting. Do we still have a print shop?
No, we don't have a print shop anymore.
Okay.
Yeah.
The print shop's gone.
Copy machines now.
Gotcha.
Yeah.
Okay. So you were working second shift at the print shop and going to college at the time. And what was your intent? What was your major or your interest once you started at Muskegon Community College?
My main intent was to get the GI Bill.
Yeah.
And that was back in those days. The GI Bill was pretty nice, and it allowed me to pay for my college and have some living expenses. And
they gave you a stipend.
Yeah. It was pretty good. And I'm telling you, college was a delight because after being in the Navy, I was ready for it then. And
right.
And it just seemed like a really nice thing to be doing. I never gave a major a thought until they made me.
Yeah, they
said, at some point.
You have to declare something.
Yeah, you've got to declare something. So I said business.
Right.
Yeah, and so I declared that I was going to major in business and finished community college. Right. And still working at Hagley through 19 76.
Okay.
So from 69 with my military leave, then through 76. And then in 77, 78, I had to leave Hagley and focus on college. I went to Grand Valley.
So you transferred to Grand Valley.
Yeah.
And what did you study there? Because
I was business
still
major.
business.
Yeah,
Okay.
Yeah.
And so I think you had told me about this story before, that you are going to Grand Valley, you're finishing up there, and there's a recruitment fair or something happening, and you were reconnected with.
Yeah. So back then they would announce that companies were coming to interview. And so I signed up and I saw that Muskegon General Hospital was there. So I said, I want an interview for that because, I'd been in hospitals since I was 17 and wanted to.
You probably had more experience than probably people twice your age at that point in hospital.
In the hospital I'd been around quite a while.
Yeah.
And so they were interviewing for an admitting supervisor. And
what is an admitting supervisor?
Well, they supervise admitting. No, it was my first management position. So
Right.
that's 38 years ago.
So your first leadership position started 38 years ago. So you've been in healthcare leadership for 38 out of your 48 years.
Yes. So
That's
so
awesome.
back then, admitting was all done on typewriters, and
Right.
And so one of my first big things was to convert that to computers, and
Right.
we were the first at Muskegon General in the community to admit people with a computer. So
Wow. And what year was that? Do you remember?
that was 1979.
Okay.
Yeah.
So pre-1980, you were converting people from
Well,
typewriter.
actually, we went live. I think it was in 1981 on the computer.
So as the admitting supervisor, what did you have your sights set on? Were there different departments that interested you?
Yeah, I had a degree in business, and so I knew I wanted to advance in the leadership ranks, and so I was admitting supervisor. Then I became patient accounts manager. Then business office manager. Then I took this radical move of moving laterally from the business office to information systems. Now, I can tell you back then, my Apple Watch today has probably 10 times more computing power than that entire hospital back in 1979. So, but I took this lateral move and became the director for management information systems.
And can you anything cool or exciting that happened with that?
Well, I think we really we expanded how we use computers in the hospital. Before then, it was just for accounting, and we started using it for admitting. As I've said, we started using it for order entry, for how we ordered, for managing the census of patients. So I didn't really consider myself a techie, but somebody who wanted to use that technology to do more things in the hospital, and so that's why I did that.
Yeah.
And at the same time, of course, I didn't mention the fact I got married. Actually, I got married back in 1976, just before I left Hagley Hospital, but in 1979 I had my first child, and so I started with the family. And while the kids were growing up, I went back to Grand Valley and got my master's degree.
Okay, and your master's was in business administration?
Yeah, business administration.
Okay, so you're a Laker
Yes.
grad.
Yeah.
Okay.
Yeah, twice.
Lots of
the first time was Grand Valley State Colleges, and the second time was Grand Valley State University.
I have my undergrad and grad degrees both from Western. So we pick one and we stick with one. That's right.
Yeah. So then my things progressed. Once I got my master's degree, I got promoted to vice president for professional services at Muskegon General.
And what fell under that position? Who were you overseeing at that
Well, that
time?
really changed things. So I went from the business office and computers to now having things like pharmacy and laboratory and imaging, and we didn't call it imaging back then, X-ray, so those types of departments, and it really opened up just a whole new career for me.
So at that time, you were overseeing all those departments as a vice president. what other things do you consider yourself exposed to, or what were you influential doing at that point in time in your career?
Well, it was in that position that you started hearing talk in Muskegon about merging the hospitals.
The mergers, yes.
Right. So that was my position when we actually had the first major merger of hospitals between Muskegon General and Mercy Hospital.
Okay.
And that was in 1995.
And you were part of the senior leadership team then?
Right, part of the senior leadership team. And certainly that merger was the biggest thing that I had ever been involved in. Even to this day, the two mergers stand out as the highlights of my career.
And what was the how was the community? What did they think about that merger between those two? Because that was probably the first merger that ever happened in Muskegon County's history between the hospitals. So
yeah,
they'd both been around for a long time.
Well, and we had been talking about merger for years in Muskegon. That Mercy, a lot of people don't realize, but Mercy and Muskegon General almost merged back in 1990.
Oh.
Ended up doing it in 1995. Generally, it was, healthcare was very competitive back then,
right,
between the hospitals, but we just found really good alignment between Mercy and Muskegon General, and Muskegon General had OB, and Mercy had more of the high tech, the open heart program, and things like that. So it was good. We both were doing well and came together, and obviously there's a lot of anxiety for staff and when you're doing a merger, but we worked through it. And
you still work with a lot of the same people that were around before that merger happened.
Yeah, it's becoming fewer all the time.
Yeah.
But it actually turned out it's been 22 years now since that merger.
That first merger, yeah.
So I became part of that team, went through that merger, and my role at Mercy at the time, it went from Vice President of Professional Services to Vice President I picked up Human Resources.
I think plant operations maybe at some point.
Well, yeah, at that time I then had a broad range, HR, plant operations, environmental services, still lab, X-ray, pharmacy, respiratory, all of those in that world. So, and so that was my next position. A couple of years after the merger, I became the Chief Operating Officer for Mercy General Health Partners, we called ourselves.
Right, MGHP. I remember that.
Yeah, MGHP. I still have some pencils at home with that name on it.
Right.
They're the best for construction. I hope I never run out of them. So anyway, we and that merger was great and a very good thing to do for Muskegon. And then, of course, in 2008, the biggest merger, which is the one that it's unbelievable that's 9 years ago.
That is.
But it was with Hagley Health System and Mercy General Health Partners came together to really make what we call today Mercy Health Muskegon. Right.
And at that point in time, you were the Chief Operating Officer and stayed the Chief Operating Officer until 2012. Okay.
When I was asked by my good friend Roger Spoolman, who was a long time, he's still now the regional president and CEO for Mercy Health, but Roger needed to focus all of his time on his regional duties, so he asked me if I would take on to allow him to do that, if I would become the interim president.
Did that catch you by surprise, or were you kind of prepared for that conversation? Or
it did kind of catch me by surprise. He informed me about 2 weeks before I had open heart surgery that I was going to do that.
So you didn't wait till after?
No. He said, "Oh, by the way, I have this one little thing to work out." So, but I got through that just fine, and in November of 2012, I became the interim president for Mercy Mercy Health Muskegon. No, it was actually Mercy Health Partners at that time. Then after 1 year, he asked if I would do it as permanent as you get, right? A permanent basis.
Official.
Yeah. So it's been about 4.5 years that I've been in this role, and 3.5 since I was interim.
Okay, so thank you for giving us that timeline. And I want you to...
I told you it was a long story.
No. I appreciate that because I want people in our community to know that you started in the storeroom or in the stockroom at Hagley and then became the president of this huge health system in our community. And did you ever think when you were 17, like you said, I just want a job so I can leave high school for half of the day. Did you ever think that you would end up where you're at? I mean, I know that you probably get that question a lot. Like, did you ever think that you'd become a president of such a large organization, knowing what you know from back then?
No, back then I used to look at these administrators. They'd walk down the hall, and I'd think, what do they do?
Right. What do they really do?
Yeah, these guys don't look like they're working. So I'm pushing a big cart, and they're just they're walking with a clipboard or something. But I've learned since it's at least as hard as being a stock person.
Yeah.
So it seems unreal to me, quite honestly, sometimes, especially when I'm over at Hagley and I'm looking at some of the areas I used to hang around, but it gives me a well-rounded appreciation for what everybody in the organization does, and I love it. I like this job, and although I'm not going to stay in it too much longer.
No, we're down to. Can you tell us what do you have left?
I think working days I'm down to about 25.
So you're under 30 now.
Yeah, it's the end of June, but a couple days off, Memorial Day and things, and weekends, and so it's about 25 days, I think, today.
Well, I do know.
Not that I'm counting.
Not that you're counting. Yeah. But, when you said you really appreciate what this organization does, the people involved in the great patient care that our community receives through Mercy Health, I do know, talking to other colleagues in preparation of this interview, that what they're surprised most is how visible you are as a president, the fact that they have opportunities to get in front of you so often, and they see you come to celebrations that they have and lunches that they have, and they feel like they know you. And they said, other people that work in healthcare for maybe other systems have never met their president, have never been in the same room necessarily. And these are clinical staff that get time from their managers in support of you to come and kind of be there and hear what you have to say. So, I think that is just a testament to your style as a leader. And I think that's just a really cool legacy to leave, where people think that, I'm a medical assistant, but I've met Greg Loomis and I've sat down to lunch with him. And
yeah, well, that's nice to hear that is people's perception. Sometimes I feel like you get caught in the office with too many meetings and you don't get out enough, but I do try and get around, and so that's nice that that's what you heard.
So we talked about some of your milestones. What are some of the best times you've had as a healthcare leader? If you just had to pick a couple. Well,
the best times would be around the times of the merger, to really see those come into fruition and see. I know that it's difficult to go through a merger, but when you see what has come of both of the mergers, it has really improved healthcare in Muskegon.
So that's got to be really rewarding and satisfying to know that.
And on a daily basis, I get an opportunity to host a quarterly above and beyond luncheon where we bring people in and we recognize them for the great work they're doing. And we're in a business that where a lot of people these colleagues are saving people's lives, and to read those stories and talk about how they've gone just above and beyond what you'd ever expect. Maybe it's somebody who takes their weekend and goes and follows up with a patient they served, or it's just it's pretty amazing. Every quarter we have one or two where it is actually a life-saving situation that we're talking about. And hearing those stories in a forum like that motivates other colleagues to say, oh my gosh, I work in the same department, and I'm going to try and do everything that I can. Yeah, it's just the whole experience. We've got really good health care in Muskegon. I know people think you have got to go to a big city to get that, but we've got excellent quality. Our physicians, our medical staff are just top notch. We look at that. It's not just me saying that because I'm in my position. The objective data shows that the quality in Muskegon healthcare is it's very strong.
It is, and we've won some recent awards, and if anybody's interested in seeing what kind of health grades awards and physician awards that have been bestowed upon Mercy Health, you can visit our website at www.mercyhealth.com and check those out, because we've got those posted. And right now, Greg, I want to kind of hear a little bit more about what you're looking forward to for the future of Mercy Health Muskegon. I know you're going to be in the community still.
The big thing, anybody that's been by the campus, the Mercy campus, knows that we're building a brand new Mercy Health Medical Center. And that will consolidate all of our inpatient services into one location. We're still going to have a presence at the Hagley campus with behavioral health and with an emergency department, medical office buildings. But this new all private room medical center is just going to be a tremendous benefit for the future of healthcare in Muskegon. We could take the next 5 hours and talk about this.
I know we could, yeah.
But it's a first-rate facility, and Muskegon deserves it, and we're so proud to be able to be moving forward with that $271 million project.
Yeah, and it's great for the Muskegon community.
It really is.
And I think it's going to be great not just for healthcare, but for eliminating the confusion that sometimes happens on where do I go for what. We're going to get everybody under one roof and really have a one-stop shop for people to get the best health care in our community. So I think that's going to be really cool. I'm looking forward to it, not just as a colleague of Mercy Health, but as a patient,
Yeah, it's going to be great. We're going to be consolidating 3 campuses that are within the 3-mile radius that were built for a bygone era. They were great for their purpose in the day, but now we need to be consolidated. It's also going to help us better support healthcare outside of the hospital, which is really where healthcare is going. It's taking care of the population in the ambulatory world.
Keeping people well, keeping them out of the hospital.
It's a strange thing, but we work real hard to keep people out of the hospital. Yeah.
And that's the new movement, and we're going to be a part of that, and I think that's going to be really exciting. So, okay, so one thing I want to ask you before we're done today is, what are your plans for retirement? I hear you're taking a trip shortly after your last day. So
we are. My wife and I are going to hop on a train, and we're going to go from Chicago to San Francisco. I've always wondered what that is like, taking a train, and I figure it's the best way for me to learn to slow down.
Slow down.
Yeah.
Turn that phone off. No more emails. No worries.
I don't know what that's going to be like, no more emails.
Right.
But I'm going to find out.
Yeah. So let's bring this full circle. And if you had to describe your time at Mercy Health in one word, what word would you use?
Gratitude. Just gratitude for the opportunity to have served and for the great people who serve the patients in Muskegon every day.
Well, we thank you so much. And I know the community is grateful for your service. So thanks, Greg. We really appreciate you coming on our program today. And we wish you the best in your retirement. I know we're going to see you around the community, and we have the Seaway Run coming up too. So
I'll be there.
Okay, we will too. All right. So thank you for tuning into our program today. Today's broadcast has been brought to you by Mercy Health. Make sure to visit mercyhealth.com for more information regarding what we're doing to support our community. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. We are Mercy Health.